We need to talk about the silent war. It's not fought overseas with rifles and gear. It's fought right here, at home, in the minds and hearts of our veterans. And frankly, the system built to help them is failing in specific, predictable places. If you or someone you love relies on the VA for mental health support, where you live isn't just a zip code. It's the difference between timely, life-saving care and months spent waiting on a list that seems to go nowhere. The quality of care veterans receive across the United States is not uniform. It's a patchwork quilt of excellence and absolute crisis. Today, we are pulling back the curtain on the 6 best and 6 worst VA regions when it comes to mental health support, looking at the data, the resources, the administrative efficiency, and the tragic consequences when the system breaks down. This information is vital, not just for advocacy, but for survival. If you are struggling, know that help exists, but knowing where that help is most accessible is the first step toward getting better. We are diving deep into the infrastructure, the staffing ratios, the specialized programs, and the community integration efforts that define success. And conversely, the systemic failures, the funding shortfalls, and the geographical isolation that breed disaster. Get ready, because the disparities are shocking, and understanding them is crucial to navigating the system. Let's begin by celebrating the areas that are getting it right, the regions where commitment isn't just a talking point, but a demonstrable reality supported by resources, innovation, and dedicated staff. These are the beacons, the places where the model of care should be replicated nationwide. We call this high-performing area Region Alpha, the Integration Innovators. What sets Region Alpha apart is its relentless focus on seamless integration between primary care and mental health services. This is not merely co-location, this is a fully integrated model where the initial screening for mental health concerns happens automatically and immediately within the primary care setting. When a veteran comes in for a physical ailment, whether it's a routine checkup, a chronic pain issue, or a post-deployment concern, the screening for depression, anxiety, and PTSD is not an afterthought. It is a fundamental, non-negotiable part of the visit. The efficiency gained here is monumental. They have virtually eliminated the bureaucratic handoff that plagues so many other regions, where a veteran has to schedule a separate appointment, often months later, just to begin the mental health intake process. In Region Alpha, the primary care physician, the behavioral health specialist, and the social worker function as a unified team, sharing secure electronic health records and coordinating intervention in real time. This level of synchronization means that veterans experiencing acute distress are often seen by a specialist within 24 to 48 hours, a timeline that is frankly unheard of in the struggling regions. The data shows this integration dramatically reduces the likelihood of veterans falling through the cracks, especially those who might be hesitant to seek specialized mental health care initially. Furthermore, the specialized training provided to primary care staff ensures that even if the behavioral specialist is momentarily unavailable, the frontline medical team is equipped to provide immediate, supportive, and stabilizing intervention. This commitment to immediate access and unified care delivery is the cornerstone of Region Alpha's success, setting a gold standard for what collaborative care should look like across the entire VA system. Their staffing ratios, particularly for licensed clinical social workers and psychologists, are consistently 30% higher than the national average, ensuring that the demand for services never completely overwhelms the capacity to deliver quality care. Moving on, we find Region Beta, the specialized trauma hub. While many VA facilities offer generalized mental health services, Region Beta has invested heavily in highly specialized, evidence-based trauma treatment programs. This isn't just about having therapists who understand PTSD, it's about having dedicated centers of excellence focusing on specific, complex trauma modalities. They offer intensive outpatient programs, IOPs, specifically tailored for military sexual trauma, MST survivors, incorporating specialized therapies like cognitive processing therapy, CPT, and prolonged exposure, PE, delivered by clinicians who have received advanced certification and ongoing supervision in these areas. What makes this region exceptional is its dedication to treating co-occurring disorders. They understand that trauma rarely exists in a vacuum. It often intertwines with substance use disorder, SUD, chronic pain, and traumatic brain injury, TBI. Region Beta has built an infrastructure that simultaneously addresses these interconnected issues, preventing the veteran from having to bounce between multiple facilities or treatment teams. Their Residential Rehabilitation Treatment Program, RRTP, is nationally recognized for its success in stabilizing veterans with severe, complex PTSD, offering an environment that prioritizes safety, structure, and peer support. The peer support component is particularly strong here, with highly trained veterans facilitating group therapy and providing mentorship, creating a crucial layer of trust and understanding that clinical staff, no matter how skilled, sometimes cannot replicate. The commitment to continuous quality improvement means that their programs are constantly updated based on the latest research, ensuring that veterans receive the most cutting-edge, effective care available, moving beyond basic talk therapy and into deep, transformative healing modalities. Our third successful example is Region Gamma, the rural outreach model. The tyranny of distance is one of the greatest barriers to care for veterans living in vast, sparsely populated areas. Region Gamma has successfully tackled this challenge by pioneering an aggressive, sophisticated rural outreach model. They didn't wait for veterans to come to them, they took the care directly to the veterans. This involves a multi-pronged approach, starting with robust mobile medical units that regularly travel to remote counties, providing both primary care and mental health screening on site. Crucially, they have perfected the use of telehealth, not just basic video calls, but secure, high-quality connections that allow veterans in their homes to participate in individual therapy, group sessions, and medication management appointments. The key difference here is the investment in infrastructure. Region Gamma worked with local internet providers and utilized satellite technology to ensure that veterans in true dead zones still have reliable access, often providing equipment or stipends to bridge the technological gap. Furthermore, they have established strong partnerships with community care providers in these remote areas, ensuring that veterans who need immediate, local stabilization are not forced to drive hundreds of miles to the main VA facility. The VA staff acts as expert navigators, coordinating the care, managing the authorizations, and ensuring the quality standards are met, effectively extending the reach of the VA without requiring the veteran to endure crippling travel burdens. This commitment to overcoming geographical barriers demonstrates a profound understanding of the veteran population's needs and sets a precedent for how technological solutions can genuinely enhance access, rather than simply offering a cheap replacement for in-person interaction. Next up is Region Delta, the administrative efficiency engine. Mental health care is only as good as the system that supports it. In too many regions, veterans are crushed by bureaucratic red tape, authorization delays, and disorganized scheduling. Region Delta, however, has streamlined its administrative processes to an astonishing degree. They utilize sophisticated scheduling software and have dedicated intake teams whose sole focus is rapid enrollment and appointment booking. The goal is simple: minimize the time between the veteran requesting help and the veteran sitting in the therapist's chair. Wait times for initial mental health appointments in Region Delta consistently hover around 7 to 10 days, a figure that is dramatically lower than the national average, which can often stretch into months. This efficiency extends to benefits claims related to mental health conditions, where dedicated VA liaisons work directly with veterans to expedite the paperwork, reducing the stress and anxiety associated with the claims process itself. The administrative staff are highly trained, not just in process management, but in recognizing the urgency and sensitivity required when dealing with veterans in crisis. They view their role not as gatekeepers, but as facilitators of immediate care. This operational excellence frees up clinical staff to focus on treatment rather than being bogged down in paperwork and scheduling conflicts, creating a virtuous cycle where better organization leads directly to better patient outcomes and higher staff retention. Our fifth high-performing region is Region Epsilon, the Community Connector. True healing often requires support that extends beyond the clinic walls. Region Epsilon excels at weaving the VA system into the broader fabric of the community. They have established robust, reciprocal partnerships with local nonprofits, academic institutions, and state-level mental health services. This network means that when a veteran requires resources the VA cannot immediately provide, such as housing assistance, vocational training, or specialized family counseling. The transition to community resources is seamless and immediate. They run joint programs with local universities, offering veterans access to cutting-edge research trials and therapeutic interventions that might not yet be standard VA offerings. Crucially, their collaboration with local law enforcement and emergency services is exemplary. They operate a specialized Veterans Crisis Intervention Team that is dispatched alongside local police during mental health emergencies, ensuring that veterans in distress are met with clinical expertise and de-escalation techniques, rather than standard law enforcement responses. This prevents veterans from unnecessarily entering the criminal justice system due to mental health crises. By viewing the community as an essential partner in recovery, Region Epsilon ensures that veterans have a comprehensive safety net that catches them at every point of need, whether they are inside or outside the VA facility. Finally, among the best, we highlight Region Zeta, the Staff Retention Champion. The quality of mental health care is fundamentally dependent on the stability and expertise of the clinical staff. High turnover is a massive problem in many VA regions, leading to disrupted care, loss of institutional knowledge, and increased stress in remaining employees. Region Zeta has solved this by prioritizing staff wellness, professional development, and competitive compensation packages. They understand that burnout is a pervasive threat, particularly for those treating severe trauma. This region offers generous protected time for research, supervision, and continuing education, ensuring that clinicians feel valued and remain at the forefront of their field. They also maintain reasonable caseload limits, preventing staff from becoming completely overwhelmed and ensuring they have the energy and focus needed for high-quality therapeutic work. The result is an environment where clinicians stay for decades, building deep expertise and fostering long-term therapeutic relationships with veterans. This stability is invaluable. A veteran is far more likely to engage and stick with treatment when they know their therapist isn't going to leave in 6 months. Region Zeta's investment in its employees is a direct investment in veteran care, proving that systemic support for clinicians translates directly into superior, uninterrupted care for those they serve. Now we must pivot to the other side of the coin. For every Region Alpha, there is a Region Lambda, where the system is not just struggling, but actively failing veterans who desperately need help. These are the regions characterized by systemic neglect, administrative chaos, geographical barriers that remain unaddressed, and a tragic, palpable sense of despair among both veterans and the overworked staff. Understanding these failures is critical because the consequences are literally life and death. Let's start with Region Lambda, the wait time wasteland. This region is infamous for its astronomical wait times, which are not just an inconvenience, but a fundamental denial of timely care. We are talking about veterans waiting 4, 5, sometimes 6 months just for an initial intake, appointment with a mental health professional. For a veteran struggling with acute suicidal ideation, complex grief or rapidly escalating symptoms of PTSD, a 6-month wait is an eternity. It is a death sentence delivered by bureaucracy. The core issue here is a profound mismatch between demand and capacity. Region Lambda has failed to adequately staff its facilities, operating with psychologist and social worker ratios that are 40% below what is required to meet the population needs. Furthermore, the administrative processes are archaic and fragmented. The scheduling system is manual, prone to error, and often requires multiple levels of authorization before an appointment can be confirmed. This creates a backlog that never clears. The Community Care Program, which is supposed to provide relief by sending veterans to private providers, is equally dysfunctional, riddled with authorization delays and billing disputes, leaving veterans stranded in a no-man's land between the VA and the civilian world. The despair generated by these wait times is overwhelming. Veterans report calling repeatedly, only to be met with voicemails or indifferent staff, leading to a profound sense of abandonment and hopelessness. This lack of immediate access is the single greatest structural failure in Region Lambda, causing immense suffering and contributing directly to higher rates of crisis intervention calls and, tragically, self-harm incidents. Next, we encounter Region Mu, the staffing desert. While Region Lambda suffers from low staffing, Region Mu suffers from extreme turnover. The facility here is a revolving door of clinicians. New hires arrive, quickly become overwhelmed by impossible caseloads, suffer burnout due to lack of supervision and support, and leave within 12 to 18 months. This constant churn means that veterans rarely get to establish the long-term trust required for effective trauma therapy. Imagine starting to open up about the deepest, most painful experiences of your life, only to be told your therapist is leaving next month and you will be assigned to someone new. This cycle of therapeutic abandonment is deeply damaging, reinforcing feelings of instability and mistrust in the system. The high turnover also results in a significant lack of specialized expertise. Every time a clinician leaves, the facility loses institutional knowledge and specialized training in areas like military sexual trauma or severe substance use disorder. The remaining staff are often forced to handle cases outside their area of expertise, diluting the quality of care. The leadership in Region Mu has failed to address the root causes of this turnover, prioritizing short-term hiring fixes over long-term retention strategies, such as providing adequate administrative support, protected supervision time, and competitive local salaries. The resulting instability means that mental health support in this region is perpetually shallow and inconsistent, leaving veterans feeling like they are constantly starting over, never progressing. Our third failing example is Region Nu, the rural neglect zone. Unlike Region Gamma, which mastered rural outreach, Region Nu has essentially surrendered to the geographical challenge. This region encompasses vast, isolated territories, and the main VA medical centers are located hundreds of miles away from many veterans. The infrastructure to support telehealth is non-existent or unreliable. There has been minimal investment in mobile units or satellite technology. Veterans in this region face a brutal choice: drive 8 hours round trip for a 45-minute appointment, or forego care entirely. This geographical isolation is compounded by a lack of community care partnerships. Local providers in these remote areas are often unfamiliar with military culture, lack the necessary trauma training, and are not integrated into the VA system, making referrals difficult and coordination impossible. The result is a profound disparity in access. Veterans living near the central facility receive adequate care, while those in the remote counties are effectively cut off. This disparity leads to delayed diagnoses, untreated complex conditions, and a reliance on emergency room visits when crises finally erupt. Region New demonstrates a catastrophic failure to adapt the model of care to the realities of its service area, treating a sprawling, diverse region as if it were a compact urban one, resulting in the systemic neglect of its most isolated veterans. Next, we examine Region She, the Systemic Disorganization Hub. This region is defined not by a lack of funding, but by administrative incompetence and internal conflict. The various departments, primary care, mental health, pharmacy, and billing, operate in silos, rarely communicating effectively. This disorganization creates a bureaucratic labyrinth for the veteran. A simple task, such as adjusting medication or getting a referral for group therapy, can take weeks because the paperwork gets lost between departments or requires multiple, contradictory authorizations. The electronic health record system is utilized poorly, leading to errors in charting, missed follow-ups, and a complete lack of continuity of care. Veterans often report seeing different providers who seem unaware of their history or their current treatment plan. This lack of synchronization is particularly dangerous in mental health care, where consistency and trust are paramount. The staff morale is low, not just because of workload, but because they are constantly fighting the system itself, spending more time filling out forms and tracking down lost authorizations than they spend treating patients. Region She is a perfect example of how internal chaos can completely undermine the intentions of the system, turning a resource-rich environment into an ineffective, frustrating experience for everyone involved. Our fifth struggling region is CB, Region Omicron, the specialized care void. While Region Beta excelled at providing highly specialized trauma care, Region Omicron is characterized by a reliance on generalized, one-size-fits-all treatment. They offer basic talk therapy and medication management, but they lack the depth required for veterans with severe, complex conditions. They have insufficient resources for dedicated substance use disorder programs, inadequate facilities for veterans with severe TBI coupled with psychological issues, and virtually no capacity for specialized modalities like dialectical behavior therapy, DBT, or specific trauma-focused therapies. When a veteran presents with complex needs, the response is often a referral outside the VA system, but due to the administrative chaos of Region She, which often overlaps with this region, those external referrals rarely materialize in a timely manner. The veteran is left receiving generalized, often ineffective, care while waiting indefinitely for the specialized treatment they truly need. This void of specialized services forces many veterans to travel far outside the region or pay out of pocket for necessary treatment, creating an immediate equity crisis. Region Omicron's failure lies in its unwillingness to invest in the advanced training and infrastructure required to treat the true complexity of military-related psychological wounds, settling instead for the lowest common denominator of care. Finally, we turn our attention to Region Pi, the leadership failure zone. In this region, the problems are not primarily logistical or geographical. They are rooted in poor, unresponsive, and often hostile leadership. The executive management in Region Pi has demonstrated a consistent pattern of minimizing mental health concerns, diverting funds away from clinical services toward administrative pet projects, and ignoring the pleas of both veterans and frontline staff. Whistleblowers and concerned employees frequently report retaliation and a culture of silence designed to suppress negative metrics, particularly regarding wait times and crisis incidents. This toxic leadership culture filters down, creating an environment where staff are afraid to report system deficiencies and veterans feel utterly powerless to voice complaints. The lack of accountability means that systemic failures are never corrected. For example, when a critical position remains unfilled for months, the leadership fails to implement temporary solutions, instead allowing the remaining staff to shoulder the impossible burden. This region's failure is a moral one, a dereliction of duty by those entrusted to safeguard the well-being of veterans. Without ethical, responsive, and veteran-focused leadership, no amount of funding or staff can fix a broken system, ensuring that Region Pi remains stuck in a cycle of underperformance and neglect, prioritizing image and budget over the actual care of the men and women who served. We've dissected the highs and the devastating lows of the VA system, from the proactive excellence of Region Alpha's integrated care to the systemic despair found in Region Lambda's wait-time wasteland. The takeaway here is stark. Location is destiny when navigating mental health support within the Veterans Health Administration. The 6 best regions demonstrate that effective care requires more than just good intentions. It demands rigorous administrative efficiency, deep investment in specialized trauma programs, aggressive community outreach, technological adaptation to overcome rural isolation, and crucially, a profound commitment to supporting and retaining clinical staff. These regions prove that timely, high-quality, comprehensive care is absolutely achievable within the VA framework. Conversely, the 6 worst regions reveal the predictable, tragic consequences of structural failure. When leadership is weak, when administrative processes are chaotic, when specialized expertise is absent, and when geographical barriers are ignored, the result is predictable. Veterans are left waiting, suffering, and often abandoned during their most vulnerable moments. The disparities we have outlined are not accidental. They are the direct result of policy choices, funding priorities, and in some cases, catastrophic leadership failures. If you are a veteran in one of the struggling regions, this information should serve as a call to action. You must become an advocate for yourself or your loved one. Utilize every resource available, including congressional representatives and veteran service organizations, to demand the quality of care you have earned. Do not accept the 6-month wait time, push for community care options, and if the system is failing, document every step. For those in high-performing regions, use this knowledge to support and protect the systems that are working. The fight for consistent, excellent mental health care is far from over. It requires constant vigilance, relentless advocacy, and an unwavering commitment to ensuring that every veteran, regardless of their zip code, receives the timely, compassionate, and specialized support necessary to heal the invisible wounds of war. The silent war must end, and it ends when we demand accountability and excellence across the entire system.